I think we probably will have to somehow work on this whole issue of that I'm also plagued with, the phone, the smartphone, which is incessantly part of our existence. And it's somehow antithetical to the idea of actually being present, right? I mean, I try to put my phone in the pocket, but then it starts vibrating. And I'm having a deep discussion with Cedric, and I'm wondering, at least for a second, who's vibrating me, right?
Right. Gotta think.
And
Is it
then
an emergency? Or is it
yeah, right, emergencies. So every moment has become an emergency in life now. Since we opened up Hayes Valley, the building across the street, 97, that was pre-cell phone, really. And I don't know how we managed with all these emergencies, right? So if somebody had an emergency, they would call the front desk, and then that was that. So now,
you just went to a phone booth.
or you went to a phone booth, right? So I do think we need to address it because we are an experiment in the making, right? The big corporations just throw those phones at us. They're very seductive. And how do we deal with that? Especially in an existential model where being here, being mindful is at the core. We also have many people who are talking about that the quality of care is directly proportional to the amount of presence that the person who cares for you exhibits. Does that make sense? You're there and you feel the person being there, or you feel the person not quite there because the person's actually somewhere else already, and you become a way station. It doesn't ever really feel all that good. It's connecting with John, and then I'm really already thinking, I really got to get to that, got to look at that phone. Got to look at that phone. Who was that?
You got to be here with me.
Yeah, right. And how to do that. Anyway, that was not the topic, but I do think we should make that a topic. Jana, who after many months of talking has, I don't know what the dictum is. I think no cell phones unless it's in a break, because care partners now have gotten the phone, right? So here you are, you're showering somebody, and the phone goes off, right? Etc., etc. You get the point. So, of course, what doesn't work is to tell you guys what to do. Because the moment we tell you what to do, there's a pushback, and you guys say, screw you, right? So it's a normal tendency. So how do we actually get people to, all of us, to buy into an idea or a philosophy of how to handle these modern devices?
If we make our presence more pleasant, live people, I think, are much more interesting than whoever's up.
Right. Well, those are very good. No, I agree with you. The issue with that is I think all of us agree that we like to be more present, that the live person is better, but then we still have that phone, right?
I would say this modeling for me when I see, directors or whoever above me, they're able to resist answering that phone. That shows me like, okay, it's possible. I can do that. For me, modeling really works well.
Beautiful. Modeling. Walking the talk.
For accountability, that works too. Give somebody the accountability, make somebody responsible, and they'll be responsible.
Mm-hmm.
Make them responsible for being present, and only in emergencies will they not be present.
Right.
And then manage that. There's a gray area around what emergencies are.
I was going to say, instead of telling us what to do, I think you've done exactly the right thing. You've involved us in a conversation where we can look at the positives and the negatives about the phone issue.
Right.
And then hopefully, we're of such a mind that, we see and can willingly agree that, there are times we just need to turn it off.
Right. And then we maybe just have, it would be beautiful if you could actually model, and also for care partners and everyone else, that we actually then just have the emergency number of the front desk. The person is there at least 12 hours a day. So that might be an approach. We can think about it, huh?
There
Yeah.
is one thing. I was trying to, is it the woman who did the food? I apologize.
Jana.
Jana, thank you. Why don't you incorporate her beautiful information? Because presence is all about being embodied, in my opinion.
Uh-huh.
And if I'm fully embodied, I'm here with you. I'm not distracted.
Right.
Food, water, sleep, space,
Yeah.
and using the restroom, she touched on at least 3 of those items.
Right.
To embody and to be fully present with someone is to have these needs, all of them met.
Right.
So why not just make it a part of the cell phone? And by the way, your cell phone kind of doesn't allow you to necessarily stay embodied, but
Right.
to go someplace else.
Good. Yeah, I think so. Maybe this is something also supervisors need to can bring up. Because I don't want to make this a prescription, because then, as I mentioned earlier, we have a pushback. So can we get to a place where maybe even from our existential orientation, that almost is a requirement. Obviously, when we are sitting with a client in a 50-minute session, kind of the standard, we wouldn't be checking the phone, right? But even now, I see therapist friends who are in between. So that 10 minutes is of just kind of dropping down is often now filled again with information. Yeah,
Well, it's also a way that people use to manage anxiety or something difficult that's going on for them. And that's where it used to be everyone would go outside for like a smoke break or something like that. It's like now everyone has a similar thing that they sort of can clip into and be somewhat self-protective. Or in some cases, I've noticed sometimes like if I'm checking the phone a lot, it's because there might be something up with my children, and which, obviously I'm not going to do out on the floor with the residents. But, I've noticed when people are checking a whole lot, sometimes it's because there's something up, something going on. They're having some kind of social anxiety, any number of things, whether off, in the rest of their life, something's going on. And they feel very distracted by that. And checking the phone is just sort of a symptom of that.
Right, that's good. Yeah. Bringing awareness to it. There's a wonderful statement I notice, or saying, excuse me, today is going to be a difficult day for me. I have a child in an emergency hospital or ICU, and I'm expecting a phone call, so please forgive me having my phone visible and checking it all the time. Right? That feels good, I think, to be able to say that. Stephanie, Judd.
Yeah.
Hey. I wanted to bring you up and Stephanie up because actually this next, is this what we're doing right now? Is this the ambiguity thing?
Yeah.
Okay. So now this is a kind of a quintessential, for me personally anyway, topic called ambiguity of suffering. And Stephanie has been helping in finishing this manuscript that we have been working on. And Judd is philosophically minded, as you've already discovered. And is fond of Nietzsche, Schopenhauer, Heidegger, and so forth, and actually has also read many of the pages of the manuscript. So I thought, and actually also struggles, I think, with the very issue that I'm going to address in the book. So I thought I'd give you a little bit of a philosophical or conceptual framework of what we're talking about, because it's kind of going to be part of our year here, those issues. And then Stephanie will do a case presentation, and Judd will chime in terms of a real life example of a person who's struggling with the issue of medication, diagnosis, what is the meaning of suffering, what's the meaning of taking medication versus not. So all of those issues are somehow being addressed here, or at least I'm trying to address them right here. So what do you think is the ambiguity of suffering? Maybe we just start with, if that's intuitively clear. Why is suffering ambiguous?
Well, it's subjective to start.
Say again?
It's subjective to start.
Suffering is subjective, yes. What is our basic understanding, mainstream understanding? Those people out there, not the ones on the rooftop here, but those people out there, they, remember they, over there somewhere? What do they think about suffering?
It's a bad thing.
It should be eliminated, yeah? It should be eliminated, right?
They think that if you don't function the same way everyone else does, or think the same way everyone else does, then it must mean you're suffering, even if you're not.
That's right. So we have an idea of what is normal, you're saying, right? And then anybody who is not quite normal, is on the is somehow suffering. Yeah, I think elimination of suffering, which of course means you have a standard. It is basically the idea that we want to remove that what causes pain, right? That's mainstream, correct? All right.
It's contagious, so it needs to be like eliminated.
It is what?
It's contagious.
Oh, it's contagious even.
It's contagious.
Yeah.
I don't want to catch it.
I see.
So take care of it.
I see. Oh, you're bringing up even a deeper point, which is seeing you suffer could remind me of something in me, and I don't want to deal with that.
Yeah.
Right.
Or suffering has different levels also. What someone else suffers from might not necessarily have you suffering, so.
That's right. That's
Very
somebody's.
personal.
Yeah, it's the subjective part of it. So now the wisdom traditions, many of the wisdom traditions. Oh, Dostoevsky actually put it very, very clearly. He says the origin of consciousness, of awareness, is suffering. The origin of awareness or of consciousness is suffering. A couple people are nodding. Why are you nodding?
Because suffering forces attention onto what is causing the pain.
Okay,
So wouldn't pleasure do the same thing?
Pleasure is distraction.
there we go.
So pleasure, I think, would cause the same attention.
There we go. Cedric's got a point. Let's just go into the pleasure. Screw the suffering.
Well, I wouldn't want to disagree with that. If
It's
you
a
don't
chicken and
ever
egg
suffer,
over
then
there.
how do you know what pleasure is?
Or vice versa.
Yeah, both. You need
Right, it's
both.
a chicken or egg.
Right, but you learn, I think we learn more from our suffering than we learn from our pleasure. That's just my
I
own-
just think it's debatable. I think we are too hung up in our suffering and we forget about our pleasures.
Yes.
Me
I was
either.
gonna say that I see emotions as motivators. So you have positive emotions, and when you're happy, who cares? You just want to keep things going the way they are.
Yeah.
But when you start suffering, you start feeling those negative emotions, you want something to change. So you start examining yourself, what's around you, what can I change to get me back to happy?
That's
So
what-
then, all of a sudden, you're feeling negative, you're suffering, you become self-aware as you examine yourself and the surroundings.
I mean, I think that still goes right back when you're starting to have pleasure, you're starting to say, what is this? And you become self-aware at the same time. I think you can go either way with that. You can't, I just find it very difficult to say that the only way that I can be conscious is if I'm suffering.
Right. And then there we go. You see? There we go, the ambiguity of it. Right.
And then there's the question of really then what is suffering itself, not just what causes suffering, but what is
The nature of
suffering.
suffering.
Is suffering just unto itself is it the lack of happiness?
Uh-huh.
Or is it actual like strong discomfort, or is it something in between?
Beautiful.
And I think that
Beautiful.
part, like in America, we do tend to think of if you're not happy, if you're not ecstatically happy, for that matter, then you're suffering somehow. You're at a lack,
Right.
and which doesn't leave a lot of room for ennui or for sort of a deeper human experience, which is why so many of us are always running to fill up the emotional hole.
Right. So yeah, that's a good question. What's so painful about pain? What's so sufferable about suffering? The nature of suffering, the Buddhists, of course, say in some ways don't get stuck, for example, if you're anxious, in the anxiety, but rather try to understand what actually gave rise to the anxiety, where we are back to the meaning of anxiety. For example, right, Rollo May wrote a book called The Meaning of Anxiety. So did Kierkegaard, the concept of anxiety. And we could say, and then we of course have now, because we want to eliminate it, anti-anxiety pills, right? So we can say, if anxiety has meaning, but we are then medicating that because we want to eliminate it, are we going to get to the meaning of it? And that's really the point here of the ambiguity of suffering. And remember, this is just an idea, and it's just one idea. So if I have an idea, as I like to say, it has to be wrong, because it's just my idea, right? So you're going to have another idea. So one idea is that suffering actually leads to a deepening of who we are. And then there is the other kind of suffering that perhaps, maybe following also what Cedric is saying, we might be able to actually look at. It might become a habit. It might be an addiction to suffering, right? Where maybe I just don't want to look at life in a way of it enriching me, right? Maybe I just have a dark, foreboding kind of look, and then we would come in as therapists and say, hey, can we work on that? Can we see where that is actually, where is that rooted? And then we have something to work on. But we have, for example, in the last, I think it was in the last DSM 4R or something, where spiritual emergence became pointed out as something that might not just be a disease, right? So if I have a conversion experience, that might not be a psychotic break. As a matter of fact, one of the most amazing conversion experiences ever detailed in the history of human literature or human experience is the Confessions of Saint Augustine. In around 600 AD, he wrote the Confessions. People know the Confessions of Saint Augustine, maybe heard the title. So here is this guy who was mostly a playboy for the first 40 years, had a good time in Rome, and then suddenly, over 4 or 5 pages, he describes an incredible, what in standard psychiatry we would call a psychotic break. Hallucinations, and he saw all kinds of weird things, and then God and so forth, and then 5 days later, he became a complete religious person, a very spiritual person. And so you could say, if modern psychiatry had gotten a hold of him during that period, they would have quickly medicated him and gave him all kinds of labels. And that's the idea of David Lukoff, actually, who was with Saybrook, saying we need to differentiate between a psychotic break, hallucinations, schizophrenia, and so forth, and people who have a spiritual emergence. Actually something is being born. So right there you also see the ambiguity of suffering. So actually the suffering is serving something, right? The suffering actually means something. And if we eliminate this suffering, good old Rilke, the German poet, was fond of saying, if you take away my demons, you take away my angels as well. Right? So don't mess with my demons, because it will make me only half a person. Right? Now the elimination of, I don't want to beat up biomedical viewpoints, because certainly the moment I have a headache I want a pill, and when my arm is broken I want somebody to fix it. But when we are talking about the psyche, that's a very different animal, or very different kind of domain. And I think what has happened, what has happened, I know what has happened over the last few hundred years is that we have used the biological paradigm that works very well with the body and does a lot of amazing things, and have applied it to the psychology of the human being. So whereas here in biology we certainly want to eliminate suffering as much as we can, in psychology we actually want to understand what is the purpose of the suffering, and is this something that really we need to lessen, or maybe, as in the example of Dante's Inferno, we might even need to go deeper, right? We have a saying in the popular vernacular that sometimes things have to get worse before they get better, right? And we often, know that somehow hitting bottom really going way down, is almost an important aspect of our regenerative power, right? Yeah.
It's like you going down to the depths and staying there and working with this art, working with this demons, working with the symbolism and all that, and writing Brit, coming back up and having a shift of consciousness.
Right. Yeah, the shift of consciousness. I do believe that, as some of you have said, that the pain is often it seems often necessary to want to go deeper and deeper, or I mean, I do think that there is a difference, even though I like Cedric's pushback about pleasure, because I don't want to make this kind of an addiction to pain, right? And there's something to be said about pleasure. But I do think that that kind of suffering is almost what wants to open up our awareness, because in some ways suffering can be understood as us just seeing life a little bit too narrowly, right? Because if you can see that life is also the gamut between, let's say, Gandhi and Hitler, then you're not surprised by all kinds of things happening in the world. But often we don't want to see that necessarily. It's hard to see that. So suffering kind of expands our viewpoint and says, this is what's going on, and this is what's going on too. And the wisdom of elders is really that we are able to say, that an elder truly can say, this is true and this is true. Can hold both parts, right? And does not judge, and doesn't give advice. Because you know that there is no advice possible. You're going to have to live your life. You're going to have to do your falling and crawling and all kinds of things. And I'm going to have to do mine. Which is one of the fond things that Jim Buchenschau would always say is when a client asks him, so what should I do with Nancy? He would have a wonderful response, which I really use quite a bit. And he would say, you know what? I can tell you what I would do with Nancy. But that would only work for me. You're going to have to figure out what you're going to do with Nancy. Else, I can tell you what to do with Nancy, but then you're going to come back when you're with Julia, right? And then we're going to be at the same place. So we can't take away the work that people have to go through, obviously. And maybe just another few points. Stephanie actually is working on some of these issues, and we were thinking that maybe in September, after the first month has settled a little, we would do a graduate seminar in the old tradition and meet once a month for a few hours and actually really try to understand some of the underlying ideas behind psychotherapy. Very few schools, if any, these days teach the philosophy of psychotherapy. But behind every theory is an image of a human being. What is that image? During Freud's time, we had an image of we had a mechanistic image, right? We talked about drives and steam. You actually sometimes even had images of steam engines going up and down because that's what was popular. What is today's image of the human being? What are the metaphors, symbols that are being used to describe a human being? Exactly. So we talk easily about, I'm overloaded, I got to download this stuff, my memory, I'm out of memory, or whatever. I mean, we use all of these words that are in the popular parlance, that are used for computers, and are ascribing them to us, right? And we just to be aware of that, how that influences our view when I look at people. When I work with a person, what is the idea behind it? If I want to help somebody, what am I helping them with? Right? Is helping, and Ram Dass was very famous of writing this book, What is Helping, or who is helping, or what is help? I forget the title. Say again? How can I help? Thank you. What is helping actually? I might actually be doing more harm than good by helping. There was some research done after 9/11. I like that little bit of research where for 5 years after the 9/11 event, psychologists followed a certain group of people to give them supportive therapy. And then there was another group, the so-called control group, that didn't get psychological care. Guess who fared better? The ones without. That's right. Why?
Because they had to develop their internal resilience system to tolerate the distress associated with any kind of aftershock event.
Exactly. Beautiful. Beautifully said. So you act, because now that is true only because, I want to just be maybe flippant about it, if those psychologists had been existential psychotherapists, that would not have been occurring. Because as an existential psychotherapist, you would say, trauma and the pain and the suffering is important, and I'm going to allow you to feel it. Because most of us psychotherapists, turn the recorder off, are trained in what we call supportive psychotherapy, which does not create life-changing attitudes in people. Supportive psychotherapy is, oh my God, poor Sue-Ann. Yeah, I can feel you. Let's just, we got to just work on this a little bit. But I feel your pain. See you next week. And we're going to do this. Yeah.
I'm out of here.
And we do this. This is supportive. And often there are many ideas about why many therapists like supportive psychotherapy. Why do you think supportive psychotherapy is, for most therapists, the preferred way of working with clients? Huh? Income, good. Yeah, well, both make income. Also, the life-changing therapist, the existential therapist, makes income.
Gives them the power.
Gives them the power. That might be good. It's easy. It's easy. Why? Good. Why is that easy, Vincent?
It's easy because, well, I mean, there's the whole concept of the fact that we're a helping profession, like there's the image of us kind of being helpers and healers, so it fits in very well to just sit there and listen to someone and give them back, hey, like.
Why is that easy, Vincent?
Because you're kind of also smoothing it over and alleviating it to work existentially and to really sit with someone's, to accept that trauma and pain are parts of life and that they need to be expressed. You also have to sit there and bear with it. So you're
Beautiful.
experiencing it as well.
That's beautiful. So for you to truly be helpful to a 9/11 survivor, you actually would have to go into the trauma and the pain and the suffering, the loss, the grief, you name it, whatever that might be, that person has experienced. You actually have to feel that. Who wants to feel that here? That's the question. There we go. One person.
What if you already do?
And if you already do, that's good. But many times, even if you already do, not too many really want to go back to that feeling. I'm just saying. Some of us do, and they're in it for those reasons of actually being there and being helpful. But many times you don't really want to go back to your own trauma, to your own pain and suffering of whenever, right? So it is exactly as Vincent said, it is not easy to be sitting with, for example, anger, right? You have a client who's just really upset. And what's our natural tendency? Calm down. Calm down. What is another approach? Which actually we like to do here because we don't ever want to tell anybody to calm down. Huh? Acknowledge, good. That's one step, and let's go another one further. Get angry with them and actually say, do it more. That's it. Actually, you could get even more angry. Is that all you got? That's all you got? You mean they beat you up and now you're trying to tell me that's the kind of anger you got? Let's both get up here. Let's have it. Tennis racket? Let's get a racket. Windows are too expensive to replace. Rackets are too. So that's actually one of the things that we would love to pass on to you during this year. When you have someone in an intense emotion, be with that and mirror it and actually amplify it. Let them really feel it. And that can be scary, so you're going to have to learn that. Right? You have to learn that. So that's supportive psychotherapy versus life-changing psychotherapy, where you actually allow yourself the pain and suffering, and especially here, you allow yourself to feel what it is like to be in your last few months or years of your life, very incapacitated from a normative point of view, but very able in another point of view, right? We actually do not use the word disabled because we're just talking about different functionalities, right? I might not hear, but I can see a lot better. I might not see, but I can feel a lot better. Whatever, it's always, and maybe Lauren, you one time, because you're struggling probably with them. Some of those things you can maybe teach us a little bit about, or anyone who feels they want to share something. We all have our strength or whatever you want to call those. All right, I think that's kind of it, huh? Stephanie, you want to say some things? Yeah?
One thing that's kind of helped me with that is just in terms of sort of the paradox of not being attached to it, but knowing that if you sit with the suffering and are present with someone who's suffering, that out of that will come something positive in its own way.
Yeah.
Positive meaning whether life-changing, something deep. So if you're
Sure.
just with it, if you're sort of just pushing it away or saying you'll get better, or even doing, I think sometimes behavioral, whatever, talking to, it's still there. It's going to come out in another way. So
Exactly.
if you go through it, so what you're doing, I think, is going through it, and then something else.
Exactly. Well, I mean, I think all of us have examples, right? Where you have gone through a so-called difficult period, and then, I think most of us would say that was part of my life, right? I mean, can I think of my life without it? I don't know. Yeah.
There's a theory about post-traumatic stress versus post-traumatic growth, and one example was a man who wrote The Gift of Fear, and he had grown up in what would be an environment where you could have lifelong complex trauma, but he has said on record that the reason why he's considered an international expert in threat assessment and being able to detect somebody who's about to misbehave is because he grew up with that level of danger, in the equivalent of, I guess, what Harlem was in. When Harlem was at its most dangerous, he grew up in a similar environment. He said he would never change it.
Right.
He's not walking around, I guess, a victim of that kind of chaos as a child.
Beautiful. I don't know if I've told you the wonderful African mythological story that that basically there's a belief that the child picks exactly the parents that will inflict the perfect wounding on the child. So you actually are looking for the two people that will. And in the story, it actually is about two arrows that are being shot into the baby. So that's the perfect wounding from both father and mother. Right? So you are being given exactly that suffering or that wounding that then allows you to become who you are. That's part of you. Okay, Stephanie, why don't you do your little case presentation? Judge, you have anything to say about that?
I agree with you. When the suffering causes me to act to relieve the suffering. I write, think, suffer. Suffering means you feel something deeply. And when you feel something deeply, you're in touch with your most creative impulses because you're fighting your way to freedom in spite of the disabling in a way. It might be disabling in the middle of the night. It might be wonderful in the middle of the night and disabling in the morning. But it's an affirmation. It's an affirmation. I exist. I live. I defy my fate, I defy the forces that are marshaled against me in my own heart, my own whatever.
Beautifully said.
Gives you a sense of aliveness.
Yeah. And I remember things that I've forgotten for years. I had to refight the same battle sometimes over and over again. My wounds, my betrayals, my fears. I had to fight them over and over again, and yet I'm willing to do it because I'm not just laying there taking it. I'm fighting back.
Through understanding.
For understanding, and I have twice in the last 2 years, I see a psychiatrist for 15 minutes every 2 weeks, Dr. Chan, and if he feels I'm suffering too much, he gives me some medicine. But if he feels I'm suffering, but I can get through it without the medication, he doesn't give me any more medication. He talks to me and he says, you think you need any medication? And if I have the strength to do it, I'll say no. If I say, oh yeah, for God's sake, give me some medicine. And I don't want to say that. I don't want to say that. I want to give up. So it's a dramatization of your own life. Thank you.
Yeah, so if I could, I actually wanted to read a little vignette to kind of bring us into the.
Well, maybe they can.
It's just for the video.
I don't know that I like it.
That'll be heard.
Okay. So, given that we're all clinicians here, how does this relate to what we're doing here at AgeSong and the way that we approach the suffering of our residents here? I wanted to read a little vignette which I actually discovered through Notter's book that we want to discuss as a group perhaps starting in September. But this isn't Notter's story, this is, what is this a story from? The Metterd Boss is the name of the psychiatrist. And the patient is named Dr. Kobling. We'll go with Kobling. And I just wanted to read a little bit of the vignette. It goes on for a few pages. I just wanted to read a little bit of it and then have us kind of discuss what sort of treatment, what sort of conceptualization first we would have for this kind of presentation, and then maybe some possibilities of what kinds of treatments. So from all kinds of orientations. So biomedical, or what you think maybe an existential therapist might do. So this is about a paragraph or so. So Dr. Kobling is a 36-year-old German woman, a psychiatrist herself, who grew up in a rigidly controlled household that expounded the values of hard work and, quote, demanded unremitting self-denial and sacrifice to duty. She subsequently worked her way up to the directorship of a psychiatric hospital, which, because of her gender, was a feat of immense effort. When Dr. Kobling entered therapy, she arrived on the verge of a collapse. She suffered from a high level of anxiety, obvious in the tremor of her hands and the wide dilation of her pupils. She experienced self-destructive impulses and suicidal ideation. She not only saw strange faces looking at her during broad daylight, but she also heard sounds differently. Normal noises and voices seemed exaggerated to her and took on bizarre, sometimes frightening meanings. So I'm just going to leave it right there, actually, and let's kind of talk about just typically how would we conceptualize this case? How would we look at these kinds of symptoms? How would we diagnose?
Well, differentially, you think, okay, there's anxiety there. Then you think about if there's some type of thought, like a distortion. There could be some kind of psychosis, so you're dealing with a psychosis and maybe a anxiety disorder, so you want to dig into that a little bit. You might want to look into some of the maybe the trauma that she had to go through to get where she was. So there might be some PTSD there.
So a lot of being in the world type things, a lot of experiences, and then, yeah.
I mean, some of the stuff that I'd probably want to ask first off, just to have sort of a couch for what's going on for her, or how she may be perceiving it, would be sort of like what her age was, when did she grow up, where she did, because the historical events could certainly shape a lot of how she's perceiving the world or how she's experiencing things. You know, I'd also want to know just more health things, probably about like how is her sleep, how is her eating, things like that around the periphery. If it weren't possible for me to find that out, then I'd probably take a very different route than if I started from there.
Yeah, so gathering history, psychosocial sort of history, and health. Was there?
I would want to do maybe a genogram of her family origin. If she has high anxiety, I maybe want to see if the origin is because of emotional restraint and unprocessed emotions, or if it's more her gestalt or her schema that comes from having been brought up in a rigid environment, and whether there was a high level of punitive parenting that's contributing to the anxiety.
Right. So we're starting to get into, this is a lot psychotherapy, which is not the way that the biomedical field. So if you went to a psychiatrist, any idea what a psychiatrist would do about this, for example?
I imagine he would look to see if there are any medications or substances that she's been using, or maybe have been involved in a case of the time.
And if not, if she's never had any, if she's never had any medications, if there's no change, if this is just happening to her, what do we do with psychotic symptoms? We medicate them, yeah. So what would be an alternative then? With the psychotic symptoms specifically? If she said she were hearing things.
She's hearing things, and what were the other things?
She saw strange faces looking at her during broad daylight, heard sounds differently, normal noises and voices seemed exaggerated to her, took on some bizarre, sometimes frightening meanings.
Perhaps some body work. Get some touch. She may not be getting enough touch if she's working all the time.
So I've noticed a lot of people have alluded to that, which is great, is that there is a sort of a quality of restriction in her way of being, her gestalt or her body, or the way that she interacts with people, being a hard-driven worker. So those are things that we're picking up on as psychotherapists.
I'd also want to know what are her stories of what she's seeing, what she's experiencing, what's her belief of where it comes from, because that's going to shape the language of how for me to speak about it, and for the lens for me to look at it from, because the symptoms are coming from her and coming from her reaction to the world around her. So whether that's literally got a spiritual basis, or it's got a physical basis, or it's got an emotional basis, it's more important for me to know where she's starting from, so that I can use her language and use her perception as my guide.
Exactly. Yeah, and I think that is really brings us home to the main point, which is the possibility of engaging the symptoms as reality, because they are her reality. And that's a novel idea, sort of. If you go to most psychiatrists, they're not going to talk to you as though your hallucinations or your delusions were real and see what the value of those might be. But this brings us back again to the ambiguity of suffering. So these symptoms are coming up, and we could look at them to see whether they might actually be meaningful, rather than just something to be numbed or pushed down or somehow eradicated, because the assumption then is that maybe she would function better, maybe she would be more productive immediately if you were able to just drug that away. But then she'd be half a person. I mean, theoretically, right? She would potentially be missing out on some meaning. So that's where the rest of the story goes.
I think the other part is that, for me, is also the question of what does she want to do with it. That's a big question. Because some people are like, you know what, I can't deal with this, give me the medication, I don't care, I can't live like this. And then other people are like, you know what, I don't want medication, and there's every shade in between. And I think their direction with that is extraordinarily important.
Right.
Not to mention from, a psychopharmacological sort of sense, I mean, antipsychotics really do they really are a dual-edged sword, whereas they do alleviate symptoms, but they create a whole host of other, physiological problems and things that are uncomfortable. So they'd be risking that person to that, and it would be terrible, especially if there was another way of alleviating the symptoms without.
Right.
I mean, I want to just say, it is true that a client can come in and say, I just want to get rid of the suffering. Just medicate me. However, it's okay. However, the disposition of the therapist, the so-called professional, is going to make a big difference in how the client is going to select the modality of treatment. Right? I mean, if I find a curiosity, as we keep talking about over the last few days, in the practitioner, and I say, wow, that is amazing. What do these faces look like? Let's paint them. What are they saying? And I actually think of them as real, because they are real. Then that invites a whole different kind of exploration than if I am kind of stern, standing there and going, wow, those are quite some images, right? I mean, signaling already that there's something really wrong with the whole thing, right? And what we will talk about process work quite a bit, but I just want to quickly remind us, just a preview, that in process work we are following different levels of reality. Right? We are talking about CR, or consensus reality, which is mostly what we believe reality is. We mostly believe reality is what we see is what we get. It's the modern scientific method, right? It's measurable, quantifiable, repeatable, right? So that's a chair, and that's the kind of reality we think about. And that's what we are basing our DSM-5 on, and this is the stuff we agree on. Money is important, how much you got, 120, great, now I know what you have, whatever. That's consensus reality. All the norms are in consensus reality. And then we have here another reality. We can call it subjective reality. We can call it dream reality. And also emergent reality. Because it's a kind of before it appears here, or it demonstrates here. Do we know what we mean by dream reality? Do you have an understanding a little bit for yourself what is meant by that? Subconscious, yes.
Like the shadows of the subconscious that they get projected onto other people. Like an expression may be seen by someone as hostile because there's something in their subconscious that is a hostility they've suppressed.
Good, you could go there. I don't even want to make it that complicated. Can all of you right now imagine yourself sitting in a cafe and it's a nice sunny day and have a cafe latte?
No. Sure.
Can you go there?
No problem.
Good. You're in dream reality. Where did that come from? You want to make that reality less of a reality than this little consensus reality? Can all of you imagine yourself being home, having a cup of something, and kicking back, and finally having a day off tomorrow? Right? Yeah. So why is that any less of a reality, any less real than the consensus reality? In the Aboriginals, as I keep saying, for them, this is actually the real reality. This is what really is, that's where they live. They don't go and say consensus reality is reality. This is their reality. Right? So, and then here, the last reality, some people call the Tao, or essence, or whatever the sentient also. Sentient reality. So when Miss Cobbling comes in and talks about all kinds of people running after her, and talks about her anxiety of being followed and so forth. That's her reality. She's here. Where do you think emotions like love and hate and wonder and so forth reside? Where do they reside? In your dream reality. So that's actually what matters. What matters is actually the dream reality. Right? I mean, really, does it matter, especially when you get to your later years of life, what you wear, whether you have channel 5 on or 6 or whatever? Very little. Right? So this is really the main reality here, and that's why taking Miss Cobling's apparitions or ideas as real is a foundational approach to working, and that it will happen all the time here as well. You want to be taken for real, no matter what your emotions might be or what's going on. Look at it as real. It is real. You know, just has a different reality to it, a different level of reality to it. So we will talk more about process work, but that's the foundation here, to really follow that process. Have in this case, Ms. Cobling write it out or act it out, you know, and not get caught in this CR reality, consensus reality, where we actually believe words have a meaning. I mean, words of course have a meaning, but that meaning is a subjective meaning. So when I say borderline, what do I mean by that? Don't get distracted by these words. Don't believe that they actually have any meaning on their own. They don't. I give meaning to them, and my meaning is going to be different from Cedric's and different from Suan's. So each time anybody uses any word that's longer than 3 or 4 letters, say, hey, what do you mean by that? Act it, do it, live it, dance it, move it, draw it, jump it, sound it, something, right?
I'm going to say, when I studied perception, I realized that, you know, even though most of us think we live in the consensus reality, you know, that's what our eyes or ears and our senses are pulling in. But perception actually occurs where that hits the stuff in the brain, and it collides. And then that's why they say, you know, if there's a fight or something happens and you have 2 witnesses, they both have a different story. It's because those stories are coming from their dream reality.
Beautiful. Yes, very beautiful.
So on that aspect, I think we all live there. We just don't exert the control that we could.
Right. Because it's kind of scary. I mean, if I'm going to talk to you about all the stuff that's happening in my dream reality, gee, you know, so it's a vulnerable space. It's an open space. It's a very creative space, but it's not controllable, right? We can't package it neatly, so we are not used to it. But it would be nice to be allowing this year a certain openness for you to have more fun with that. Okay, I think that's it for Stephanie. Anything else?
No, just to finish up with the doctor working through this, she actually had more different symptoms, sort of regressive symptoms, letting herself really be a child, and then out of that actually did find more meaning in her life. And so the last kind of quote I thought was interesting. So she did she started doing sculpting and would sculpt back and forth between, I think, a rigid crucifix, so the one kind of, and then a graceful dancing girl. And at the end, kind of a symbol of her growth or her deeper meaning that she found, the doctor suddenly realized that God pervades everything, even a whore dancer, is the quote. So she basically found meaning in integrating more richness in her life. So I thought that was kind of a nice ending.
Beautiful. Good. Thank you.